Hey, this is Michael Roberts, current Chief of Staff here at East Alabama Medical Center, and I wanted to talk to you a little bit about the COVID-19 vaccine. We know that there's a tremendous amount of misinformation regarding this vaccine and its implementation, and that some of you may have concerns about whether it's safe for you, and so we want to address some of those fears. I'm going to do an introduction. Dr. Carrie Henserling and Dr. Misha Wallace are also going to be giving you some information that we think is important for you to know when considering whether to take this vaccine. One concern that I've heard expressed several times has to do with the speed of development of this vaccine and whether a vaccine that was developed in less than a year can truly be safe. For starters, messenger RNA technology is not new. As we mentioned earlier, this is the mode of creation of the vaccine that we have here, the Pfizer vaccine and also the Moderna vaccine. They're messenger RNA vaccines. That technology has been in development and I believe truly waiting for a time like this. What that technology allowed us to do was, once we had the genetic code for the virus, we're able to mimic that with the messenger RNA to encode those proteins that are identical to the spike proteins on the virus. So we already had messenger RNA technology ready, and then now we have the genetic material, and that allows for rapid development of the vaccine. Even once the plan is in place, though, there's a series of steps in creating a vaccine to ensure its safety. Phase 1 and Phase 2 trials are typically run in series, but in this circumstance, we're able to be run concurrently. This helped to speed the development of the vaccine. The Phase 3 trials are truly the ones that have to do with safety. This is the data that you've seen recently. The Phase 3 trial for the Pfizer vaccine included over 40,000 patients. And those patients, after they received the vaccine, were followed for a minimum of 2 months. This was required by the FDA for the emergency use authorization. Unfortunately, the reason that this vaccine was able to get through Phase 3 trials so quickly is because this pandemic is so bad. They needed to see a certain number of patients actually develop COVID-19, and so enough patients had to develop COVID-19 in the placebo arm of that trial to be sure that their vaccine was effective in the treatment arm of the trial. And that's exactly what we saw, that in patients who received both doses of the virus, they had a strong antibody response by 7 days after that second dose, and in 95% of the cases, it protected them from developing COVID-19. It had a very good safety profile. Most patients had symptoms that were very similar to those who received placebo. The only things that were more common in the patients who received the vaccine were things like arm soreness, low-grade fever, headache, and some fatigue. For most patients, these symptoms have resolved within 48 hours and did not limit their activities, including going to work. I know after I received my vaccine, I worked the following day. I was a little tired that morning, but felt back to normal by the following afternoon and was completely symptom-free at 48 hours. A second concern that we've seen mentioned is regarding the use of fetal tissue in the development of vaccines. I know it's a very important issue for a lot of people, and I don't want to minimize the importance or the significance of that issue. Regarding messenger RNA vaccines, so I'm talking about the Pfizer vaccine and the Moderna vaccine, fetal tissue, fetal cell lines are not utilized at any point in their development. The vaccine itself contains no human or animal tissue whatsoever. And so at least for the messenger RNA vaccines, this is not an issue. There is no fetal tissue utilized at all. Another question that we've heard is, well, if I've had COVID-19, do I really need to get this vaccine? And we believe the answer is yes. The truth is, nobody really knows how long your immunity lasts after you've contracted COVID-19. For most patients, it probably is at least 90 days. But beyond that, nobody's really sure. And so our recommendation is that even if you have had COVID-19 in the past, that you proceed with vaccination in order to ensure your immunity going forward and to help protect you and your loved ones. We've seen a tremendous amount of misinformation, beginning with the COVID-19 pandemic in general, but now extending to the vaccine. And we're afraid that this misinformation may inhibit our ability to administer this vaccine on a widespread basis and hopefully put an end to this pandemic. For those of us who are caring for patients with COVID-19 and have seen the death and destruction as a result of this pandemic, we truly have hope for what this vaccine can do. And so when you are considering whether you should receive the vaccine, absolutely educate yourself about the vaccine, about how it's created, about the potential side effects, but also about the potential benefits. But do so from reputable sources. There are a lot of people out there who don't have correct information and who are releasing information that can be frankly harmful. So absolutely educate yourself, but do so from healthcare organizations, from people who know what they're talking about, from people who have your best interests at heart. Now I'm going to turn this over to Dr. Carrie Henserling and Dr. Misha Wallace so that they can give you their opinions on this vaccine, its safety, and its potential to help us end this pandemic.
So one of the questions that I'm already getting quite a bit is, do we know if the vaccine, currently the Pfizer vaccine, is safe in women who are potentially going to conceive in the near future? Could it affect fertility or those moms that are breastfeeding? And so that accounts for quite a large population when we consider that so many of our frontline healthcare workers are female, and so many of them are in that age where fertility is something that they want to consider, whether they've had kids yet or not. So I want to address a couple things. First, we do know that the Pfizer vaccine and the other vaccine that should be coming out relatively shortly are not live virus vaccines. They're not attenuated virus vaccines, and by attenuated, weakened virus vaccines. And so it doesn't actually contain any viral particles. The protein that the vaccine contains doesn't enter the nucleus of the cell, and therefore it can't alter the human DNA. So it can't alter your genetics. So we don't expect for it to have any effect on infertility. One of the other concerns has been, I believe there was a blog that came out that suggested that the vaccine could potentially cause the body to mount a response to a placental protein. Well, the way the mRNA, the messenger RNA vaccine, the Pfizer vaccine works is that it does have this mRNA material, and it's supposed to mount a response in the body to a spike protein. I thought it was really interesting because I too wanted to do my own research, and I came across a great article by a physician at Duke who is an immunologist and works in maternal fetal high-risk specialties. I thought one of the best examples she gave in her discussion was that comparing the spike protein that we associate with coronavirus to the placental protein that seems to have gotten so much attention or controversy would almost be akin to confusing a rhinoceros or a jaguar because they are wearing the same collar. And I thought that example was fantastic. It makes it easy to understand. And while I went through medical school, I obviously didn't spend a lot of extra time on immunology and the genetics of vaccines. So I too need to look at those that are experts, those that have done more research than myself in that area. So I even appreciated um, the metaphor that she provided. As far as in lactating moms, we don't believe that there should be any additional risk for lactating moms versus those that are not lactating, just based on the mechanism of action of the virus. Again, like I said before, it's not a live viral vaccine. We do know that lactating or breastfeeding moms shouldn't get like the smallpox vaccine because of that category. But for the most part, breastfeeding moms have been getting vaccines for years. And this one too, based on the mechanism of action, should be considered very safe.
My name is Misha Wallace, and I am a board-certified pulmonologist and critical care physician. And what that means is that I have been on the front line for the better part of a year of this COVID pandemic. Having been in the medical field for 20 plus years, a little over 20 years, I can honestly say I've never seen anything like this. I've been in the hospitals through tornadoes, through mass casualties. I lived in New York, worked in Brooklyn, New York, at a Trauma One Center, and I've never seen anything like this before. When I speak to my colleagues that have been in the medical field much longer than that, they tell me they've never seen anything like this before. And what do I mean by that? There's mass devastation, sorrow, a feeling of being useless at times, watching people suffer, and some eventually die. And now we have something that could prevent that. Why would we not take it? I was one of the first ones to get it when it was offered here. I knew once we got the news that it was available that I would take it. And the reason I took it is because I've seen the effects of COVID-19, not only on my patients, but on their families, on their loved ones, on the staff taking care of them, on every single member of our hospital team. Everyone's overworked at this point. Like I said, it's been a better part of a year that nurses are doing mandatory overtime, that physicians are working 7, 8, 14 days in a row, that our ancillary staff are being pushed to the brink of exhaustion. Why would we not take the vaccine? I would encourage anyone who's eligible to get the vaccine. Speak with your physician, of course. I've done some research, and what I mean by that is I've read the papers that the experts have put out there. And this is 95% effective with minimal side effects. And I'm confident in that.
I really appreciate Dr. Henschling and Dr. Wallace taking their time to talk to us and give us their perspective on COVID-19 and on this vaccine. They each have a unique perspective coming from the worlds of obstetrics and pulmonary and critical care medicine, not just on COVID-19, but on what we can do to end this thing. I think that's what we all really want to see. I know for me personally, when we're talking about a vaccine and we're talking about what it's going to take to end this pandemic, I look at it in terms of numbers, and I feel like it's simple math. We all have fear of the unknown, and I think when we're talking about that vaccine, that's what's at the root of all of the concerns is, yes, it's new, and as I mentioned earlier, I do feel like it's safe, even though it's been developed quickly, but we don't have years and years of experience with this vaccine in the same way we do with, say, a flu shot, which we all get every year. So on the one hand, I have this unknown entity. What if there's something out there that when we give this vaccine to 100 million people, what if there's a problem that we haven't recognized yet? The Pfizer trial, to take one, was powered to find adverse effects that happen in 1 in 1,000 patients with about 83% accuracy. So that's pretty rare. Of course, when you expand that to 100 million people, that could still be potentially a lot of people, but there's that out there. There's that very, very small chance that something could happen that we haven't seen yet. On the other hand, I have a known entity in COVID-19. And I think we've all seen firsthand what COVID-19 can do. We've seen our hospital pushed to the brink with patients, with its effect on our staff. We've seen this pandemic take over 300,000 lives in the past 12 months in our country alone. And so if I take the potential, the very small chance that I could have an adverse effect to this vaccine versus the very real entity of COVID-19, it was an easy decision for me. And even though there's that little bit of fear about whether I should get a vaccine or not, I know in the long term that I can protect myself, that I can protect my family, and that collectively we can do something to end this pandemic. So thank you for your time. Thank you for your service to our hospital and to our community over the last 12 months. And I want to encourage you to continue to be vigilant and to consider taking this vaccine to protect yourself, to protect your community, and to end this pandemic.